cognitive stacking. In cognitive stacking, the study showed that RNs had between 11 and 21 things cognitively stacked at any given time. So the number of things they had to remember and hold in their minds was between 11 and 21, and the average for a nurse at any given point in the shift was 15. 80% of the time, they had more than 13 things. So that is a huge amount of cognitive work that is generally unrecognized among nurses. We have, in the UK, we have government officials who see nursing as being caring and that it can be learned by apprenticeship and doesn't need to be university educated. Based on that research and the different types of cognitive activities that are needed by nurses, I would dispute that very strongly. And finally, we have organizational labor. So organizational labor refers to documentation, connecting with other colleagues, answering call bells, answering telephones, arranging things with other departments, following up on missing medication, missing equipment, and all those kinds of things. So organizational labor is as old as nursing, but it has long since been dismissed as not being real work. Myself and other colleagues, we've said things like, oh, I have to do paperwork, it's taking me away from my patients and that type of thing. But actually, as Davina Allen explained, organizational labor is central to patient care and it creates patient trajectories through the healthcare system. So, for example, when a patient is being discharged, that discharge summary contains information that propels them through the system. And if it's written badly, there can be repercussions for up to potentially months. Also, there's this myth that current nurses are overburdened with paperwork, and statistics from nursing organizations show that nurses spend about 30% of their time doing organizational labor. Well, in 1953, the first study of nursing work, nurses spent 30% of their time doing organizational labor. So while the content of that may have changed, it might have a different quality to it, still that much time is being spent. So if nurses are feeling that that's taking them away from their patients, it becomes a question of what is being lost and why is this work not being recognized as skilled and difficult and essential to patient care. So we have a lot to think about within this model, and I'm going to move to the summary highlights that are included. So nursing work can be understood as different domains of labor, so different parts of a whole. It's valuable to look at each part and appreciate the qualities therein, but also to see nursing work in a comprehensive way. Nursing work is not only patient care. There are other sources of demand as well. So nurses don't just care for patients. They also manage the context in which care takes place. They look after the environment, they coordinate other healthcare professionals, they problem solve, they prepare for discharge or prepare for admission, whatever the case may be. They look after the entire spectrum of the patient's interaction with the healthcare system. And that has a lot of different qualities to it, but the idea that nursing work is only patient care is a misleading one, and it doesn't serve us well. We can also see that nurse researchers have only focused on part of work and have looked at different pieces in isolation. That has value as an initial starting point, and I think now the time is ripe to bring that all back together and say, what is the total burden, if you will, of nursing work as a whole? So some questions that you can reflect on. Do these narratives or do these different types of labor, do they reflect on your practice? Does that make sense to you? And can you think of examples of them? And then do these types of labor reflect in the images that we see of nurses and the way nursing is portrayed? I'm going to look in a little more detail at some examples of pictures of nurses and contrast kind of better examples with poorer examples. I'll say right now that the images I'm about to show, they're all women and all the women are white. This is a major limitation, and I recognize that nursing is very diverse, but this reflects the pictures that are being used to represent us. So while there are others out there, I think it goes to show that the dominant image of nurses is still as white women, and that is reflected in the media that is produced by nursing organizations. So in spite of that limitation, I'm still going to talk about some of the different things here. So this is from the Ontario Nursing Association, Nurses Association, in Canada, and it looks at how nurses use knowledge. So the campaign is called Nurses Know, and it's a campaign for safe staffing. And this advert was used to organize nurses to take shuttles to go to the provincial legislature, the seat of government, and to present the petition and protest about needing safer staffing and needing better care. But it leaned in directly to the idea of nursing knowledge and expertise. So this picture and others like it were on the sides of buses all over Canada. And this is from the Canadian Federation of Nurses Unions. And it was the idea that nursing hours save healthcare dollars. So they made an economic argument for nursing, not just one based on caring and compassion, but on economics. And while I would never say that nursing comes down to dollars and cents, I would say it always comes down to people. As part of a larger narrative, this is really effective because there are people out there that will be driven by economics when they make decisions. These are really cute. They're again from ONA. And they framed nursing as though nurses were athletes. And as you see, the tagline says, if only registered nurses were valued the way pro athletes are. So we've got nurses celebrating a big win. We've got a signed scrub top there, and also an action figure of a nurse. And this was on a bus station in a Canadian city. But you can see, even though this is very fun and kind of lighthearted, cute pictures, nice idea, it has that serious undertone. And also on the image here, it says over 40 skills. So even though they're showing the nurse in kind of a cartoonized fashion, they're still emphasizing the skills. And she's holding a stethoscope and a blood pressure cuff, things that imply that this nurse is skilled. So it's not about this nurse necessarily doing something like feminine or stereotyped. It's about her being skilled, even in the context of something that's quite lighthearted. I really like this image from the United Nurses of Alberta. So here, they're advocating against violence against nurses, and so their Nursing Week campaign focused on addressing violence against nurses. And here you have a nurse that's by herself. She's not with a patient. She's not doing anything that relates to patient care, and she's also not smiling. And I think given the way that nurses are generally portrayed, those are really important. So this is a very impactful message and reminds the public of their role in advocating for our profession as well. However, these are in sharp contrast to these adverts, which were used to try and recruit nurses. And these, you know, the nurses are smiling and they have kind of romantic, almost pseudo-sexual references in them. And it's about the nurses being cute, and they aren't obviously doing something that's skilled. And I mean, you can see for yourself, it's just very, very sharp contrast to other images. And I don't feel that it reflects any of those domains of labor that nurse researchers have explored. So there's a lot to think about here. I think it's really important to consider how nursing labor has been understood and then how that translates or fails to translate to images of nursing and representations in the public eye of what nurses do and how they should be valued. So my PhD continues, but I leave you with all of this in the hopes that it will spark some conversation and some discussion and provide some reflection for nurses and for others who are supportive of our profession. Thank you. Take care.